This is Dr. J back again with the Human Movement Institute, where we have improvement through movement. Today we will be discussing brachioradialis muscle mobilization. The brachioradialis muscle has a nickname known as pseudo tennis elbow. So this muscle can indeed mimic lateral elbow pain from lateral epicondylalgia, but it's not, because it's from the brachioradialis. This muscle starts roughly at the proximal edge of the distal humerus on a section called the supracondylar ridge, along with the lateral intermuscular septum. It then traverses distally, where the muscle ends roughly at the mid-lateral radius, and then it has a long tendon that goes down to almost the radial styloid. Not clear down onto the radial styloid, but just back up from it. The literature has shown that the primary action of this muscle is elbow flexion with forearm and neutral rotation. However, there has been some debate that this muscle helps with pronation and supination. We'll leave that to the anatomists, and we'll focus on treating it to help you resolve your lateral elbow pain that radiates into the lateral forearm, as well as pain that goes into the dorsal web space of the hand. As always, make sure you have a good differential medical diagnosis and an accurate human movement diagnosis to know that these symptoms are indeed from the brachioradialis and not from another source. So how do we mobilize the brachioradialis? One of the best ways is to start with the small self-care mobility tool. Find the lateral epicondyle, the prominent bump on the outer elbow, and go up just a bit onto the humerus. Here you will find the supracondylar ridge. It's a little ridge that slopes down to the epicondyle. If you have trouble finding the muscle, engage or contract the brachioradialis to feel the muscle action under your hand or tool. Start with ball rolling, progress from up and down to cross fiber to tack and twist. Next, we're crossing the elbow to engage the brachioradialis. Here I'm mobilizing with muscle, gentle forearm supination, pronation. Then I can tack, twist, shear with muscle fiber, or cross muscle fiber. We can also use contract, where I resist my own elbow flexion, and then relax, where I put the muscle on stretch as I mobilize it. Initial starting dose is anywhere from 3 to 5 minutes. And for some, if it's really tight, even longer. You might spend 5 or even 10 minutes on it. The goal is that it starts painful, but as you spend more time releasing and mobilizing the muscle, it becomes less painful. I would do this no more than once a day, and then in some patients, every other day is enough. And then for prophylaxis or prevention, especially if you're a person that has to do work or you do exercise with lots of elbow flexion, an exercise that comes to mind is the hammer curl at the gym, where you have the forearm in neutral rotation and you're flexing the elbow to strengthen the lateral forearm musculature, and in particular brachioradialis. This muscle can be the culprit. And then to stretch it, it's a tricky muscle to release because we have to get full elbow extension, and I'm trying to find the exact forearm and elbow angle to get the stretch along it. I like to even mobilize mine in between some passive stretching. When it comes to passive stretching, 2 joint muscles, the literature says 30 seconds to 1 minute, 2 to 3 times, twice a day to have a significant improvement in muscle length. Yet again, remember, brachioradialis, known as pseudo tennis elbow muscle, because it can cause or mimic lateral elbow pain. It can cause radiating side lateral radial forearm pain and or dorsal webspace pain. If you like this video, please hit the like button, the subscribe button, and please share it with your friends, family, patients, and colleagues. Take care and see you all again soon.